Elsa.
Baie dankie Jornay. As deel van Wêreld-diabetesdag kuier die besigheidsvrou Fawn Rogers saam met ons om oor haar stryd met diabetes te gesels en ook te verduidelik hoe dit haar lewe verander het. So good morning Fawn and thank you so much for joining us.
Morning, thank you for having me.
Let's start with what or who exactly is the Transplant Education for Living Legacies?
So Transplant, as you said, is TEL. We are an organisation that raises awareness for organ donation in South Africa. So we encourage people to talk about it and have the conversation with their family, whether or not they do wish to donate their organs once they've passed away.
And when did you get diabetes and what type do you have?
So I was born with a genetic disease called cystic fibrosis, and in 2013 I actually had to have a double lung transplant. It was the only sort of treatment left for me. So that's how I got involved with TEL. And with my disease, cystic fibrosis, comes a whole bunch of other issues, one of them being diabetes. So when I was about 16, I developed cystic fibrosis related diabetes, and I had to start injecting myself with insulin. So I have been diabetic. I'm now 33, so I've been diabetic for a long time. And it is a progressive disease. I have type 1 diabetes. So when I started, I only injected myself once every day in the morning, and now I have to inject myself every time I eat, which is 6 times a day. So it has progressed, and unfortunately, as it progresses, you learn more about the illness.
Fawn, please tell us, what is it like living with diabetes?
So diabetes is one of those unfortunate diseases where it's very high patient admin. A lot of illnesses, the doctor prescribes you some medication, you take the pills in the morning and you're done. Diabetes, you've got to be very sort of self-monitor yourself. I have to check my blood sugar all the time. I have to calculate whatever I'm eating. I need to know how much sugar is in that food so that I can give myself the right amount of insulin. If I give myself too much insulin, then my sugars drop and I feel terrible and want to faint. If I don't give myself enough insulin, then my sugars go high and I need to monitor that and give myself more insulin later. So the diabetes relies a lot on the patient to do their sort of homework on what to eat and what not to eat and sort of scale their insulin accordingly. It's a very difficult disease to live with, but on the upside, it is very treatable, which, some diseases there is no treatment for. So with diabetes, if you can manage it, then, you shouldn't have too many issues.
Now, obviously, you had to adapt in many ways. What would you point out as the biggest challenge that you were experiencing?
So when I was first diagnosed, and I think this happens to a lot of people, you're quite ignorant as to what sort of nutritional values are in food and what the glycemic index is of food. I just thought, okay, I'm diabetic, I mustn't eat jelly babies and chocolates, but it's a lot more than that. There's hidden sugars in so many things. You go and get a smoothie and you think, okay, I'm being healthy, I'm drinking a smoothie, but that's just loaded with sugar, which not bad sugars, but for a diabetic, it's sugar nonetheless. So I think for me, the learning process of understanding food and how it all contributes to your blood glucose level, I think that's sort of one of the biggest challenges. And it's still a challenge because you go to a restaurant and I know that if I have a salad, that, my sugar should be okay. But then they dress the salad with a salad dressing that's full of sugar. So it's kind of this constant battle of being aware of what you're eating and, just trying to do your best to make the right decisions.
Fawn, Jornay here. I'm the ugly presenter. I just want to say your energy in just reading about the things that you do, what keeps you positive? Because, you're a real go-getter and maybe that can just motivate someone.
Yeah, so, I think there's a lot of different things that motivate me, but one of them is that I know, I spent a lot of time in hospital for checkups. And like I said, I had a lung transplant, so diabetes is only one part of my sort of illness. But I spend a lot of time in hospitals and I'm constantly reminded that there's always someone worse off than you. You are allowed to have a day where woe is me and why me and this is not fair. That's totally allowed. But at the same time, you need to remember that you are most likely a lot more privileged than most people. So for me, it's kind of just remembering that yes, I have diabetes and all these other things, but, you know, I've got a roof over my head, I've got a loving family and friends, I've, you know, all of those things. And for me, I focus on things to be grateful for.
We still have a lot of questions, so just stay where you are en bly ingeskakel vir die res van hierdie interessante gesprek. Ons gaan voort met vanoggend se gesprek met Fawn Rogers en sy is die bestuurende direkteur van die Transplant Education for Living Legacies, oftewel deel. En dit is nou as deel van Wêreld-diabetesdag. So sy gesels bietjie met ons om oor haar stryd met diabetes dan nou te praat en dan ook te verduidelik hoe presies dit haar lewe verander het. So Fawn, welcome again and thanks again for joining us. Do a lot of South Africans have diabetes?
Yes, they do. So the figures that I've got are about 3.5 million South Africans have diabetes and about 5 million are pre-diabetic. They also think that there are about 2 million undiagnosed patients, which is probably the most concerning because that means that we don't actually know how many diabetics there are because people haven't sort of had the opportunity to go in and be diagnosed.
What new treatments are there?
So diabetes, I get quite excited with medical advancements. I mean, obviously being a lung transplant recipient, that in itself is pretty futuristic. So with diabetes, there's constantly new equipment, new treatments, new learnings, and so on. So one of the newest things out there, which I'll show you now, is it's called the Dexcom. So what it does is it's a little needle in your arm. It stays in your arm. I don't know if you can see mine there. And it stays in your arm and it measures your blood glucose consistently and then tells your phone what your blood glucose are at any given time. So this is amazing because usually what a diabetic would have to do is sort of prick their finger and check their blood pre or post meal and then they would get a reading. And this reading is not that accurate because you don't know whether that level is going up or down. You just have the information that you have now. Whereas with the Dexcom, you can see all these beautiful graphs. You can see if your sugars are starting to dip or kind of going a bit high. So you can kind of preempt what's happening and then control it a lot better through that. So it is a bit of a burden, if I can say, to wear it all the time and change the needle constantly. It's very expensive as well, but it's helped my diabetes a lot. And I think it's pretty cool.
And what are some of the typical signs indicating that you might have diabetes?
So type 1 diabetes is genetic. So if your parents are diabetic, then the first thing you should be aware of is that you're at more risk of being a diabetic. And then just general symptoms would be being thirsty all the time, peeing a lot, being fatigued. Those are just some of the symptoms. And then for type 2 diabetes, if you're overweight, then you are at risk of type 2 diabetes.
What can you do to lower your risk of developing diabetes?
So type 2 diabetes is predominantly, I think they say about 87% of cases is due to people being overweight. So the biggest thing there would be obviously to control your weight, regular exercise. And also, like I was saying earlier, it's important to know and have a bit of food knowledge, even if you're not diabetic. So if you can try and avoid your refined sugars and processed foods, then that will also help, prevent these sort of diseases.
Can you donate your organs and tissue if you are diabetic?
So with any disease, it's not a yes or no answer because what happens is, as a diabetic, my pancreas is obviously fried, so they wouldn't give that to anyone. But at time of death, what the medical team do is assess you and they say, we may not be able to use this organ or this organ, but we can still use this organ, maybe corneas, maybe skin. So the answer is that everyone, should be an organ donor. And at time of death, you'll be assessed whether or not you can actually donate your organs.
Your name here again. I just want to find out for children, what age, is the danger age for diabetes, and how young can you be diagnosed with it?
So I actually see a pediatrician endocrinologist. So I go and sit with all the kiddies in the waiting room while they're waiting to see the doctor, and it's really sad because there's kids. I mean, as little as they're big, tiny little things, 4, 5, 6-year-olds. So, I mean, type 1 diabetes, like I said, it's genetic. So it's nothing that you or your child has done to develop it. It just happens to be, your pancreas stops making insulin. So for type 1 diabetes, I mean, there is no age, as early as birth, I guess, you can have symptoms. Type 2 diabetes is more lifestyle orientated. So I don't think you would kind of see those symptoms until, your child does start to pick up weight and those things.
That was my question. What is those symptoms? I mean, it's like picking up weight, but other symptoms that you can know this is something bigger than just a flu or is ill?
Yeah, so with children, it's a strange one because when you're overweight, like I said earlier, you are more at risk of diabetes. But one of the symptoms of diabetics, especially in children, is actually weight loss. So if your child is failing to put on weight despite you feeding him or her constantly, then the chances are that, you should go and get tested for diabetes. So I would say in children, failure to thrive would be a big symptom or warning sign for diabetes.
Now, Fawn, clearly you've made a mind shift and you are a true inspiration to us. So thank you so much for joining us this morning and, to elaborate a little bit more on your journey. Well, there's still time for a last question.
Yes.
I would like to ask you, in terms of that mind shift, how would you motivate people to, look at it differently when being diagnosed with diabetes?
So I think when you're diagnosed with any illness, it's a scary time. I mean, you hear the word cancer or diabetes or AIDS or whatever, and immediately your brain goes to the worst case possible. But today, like we were talking about, there's so many advancements in the medical field. So the first thing is it is a big pill to swallow, but the sooner you swallow it and just kind of accept it and do your treatments and kind of get on with it, the better, because, these diseases are manageable and there are always people worse off than you. So kind of, it's not a great illness to have, but it's also not the worst. So you just need to wrap your head around that.
And then I also see that Transplant Education for Living Legacies, or TEL, is also more than happy to answer any questions. Say, for instance, our viewers do have questions regarding organ donation. They can just drop you an email, right?
Yeah, we're also on social media, on Facebook, Twitter, and Instagram. If you just look us up, TEL.org.za, we'll be on all the platforms, and we're more than happy to answer your questions on organ donation, diabetes, whatever your audiences have.
Now, Fawn, thank you so much for joining us this morning.
Thank you. Thank you so much for allowing me to share my story and raising some awareness about diabetes. Tomorrow is World Diabetes Day, so hopefully this interview reaches a lot of people and answers some of the questions that people had.
Wel, dit was dan Fawn Rogers, die besturende direkteur van die Transplant Education for Living Legacies.